Active procedures and screenings. Experts say one of those screenings, mammograms. Lindsay Jackson found out why early detection is so important and really can be a matter of life and death. Lindsay.
Yes, Dana, as Breast Cancer Awareness Month comes to a close, breast cancer survivors and local doctors are still urging the community, especially middle-aged women, to get their annual checkups. They say if something feels off, it probably is. Nina Story was just 34 when she was diagnosed with breast cancer. After 2 diagnoses, a double mastectomy and a hysterectomy, she says early detection saved her life.
My treatment was pretty aggressive, but I feel like it really was important for me to find that early because I could have, the stage of cancer could have been worse, which would have involved a lot more surgery and things like that.
Medical experts at Terre Haute Regional Hospital say they've seen fewer patients come in for mammograms since the pandemic began.
Patients are afraid or scared of going out and getting screening done. However, if a patient has symptoms, meaning if they are having a mass or breast pain, they should not delay any of the screening procedures. They should go and get it done right away.
She says early detection and annual mammograms are key to treat breast cancer.
As we know that earlier the breast cancer is detected, higher the chances of cure. A person who is detected with a stage 1 or a stage 2 breast cancer has about 99% of cure the survival rate is about 99% in the first 5 years. The later stages of diagnosis have poorer outcomes.
Story and other breast cancer survivors have benefited from the advocacy of one woman named Coral Cochran with the Wabash Valley Breast Cancer Survivors Organization. She spent years lobbying in Washington, D.C. for breast cancer awareness. The group offers support and funding to women in need of getting their annual exams. Story says she's proud of how far they've come, but there's still work to be done.
There have been tremendous moves forward in terms of treatments, in terms of decreasing the death rate, extending survivorship, but we can't let off the gas pedal. We have to keep advocating, keep moving forward.
Now, Dr. Shah says those over the age of 45 should receive a mammogram annually. And if you have a family history of breast cancer, you should consult your doctor to develop a prevention plan and genetic testing.
All right, thanks so much for that report. Well, the Will Center in Terre Haute aims to grow their Terre Haute Work to Include chapter. The Will Center provides resources to people with disabilities and their families for independent living. October is National Disability Employment Month. The organization worked on projects to help incorporate a more inclusive workplace. Jared Price with the Will Center says there have been conversations with the mayor about looking at the city's hiring practices. Price says there are 11 coalitions working toward inclusion in the workplace across the state.
The local coalitions are great, and here's why. They allow individuals with disabilities and their families, as well as any self-advocate, to come together to help gather input and design a system that will work to include everyone.
And one item the coalitions have worked toward is the website worktoinclude.org. Their employers can find resources and training to make their workplace more inclusive. The Terre Haute Work to Include chapter has several community partners like Mosaic, Vigo County Schools, and ARC of Vigo County. Price says anyone interested in joining those efforts should reach out to the Will Center.